Sorry.
Hi, Dr. Francis from the Marion Animal Hospital. Good to see you.
Good to see you too.
Yes, it's good to see you and not bringing Marley in and having Marley run all over the place.
Oh, Marley's so cute.
Oh, yeah, she
Marley.
is. And so was Shadow.
Oh,
I
yes.
still miss Shadow.
I know.
He was pretty frisky.
Yeah.
He was. So, tell me what's happening.
Well, in terms of?
In terms of what's the latest thing we should be looking for?
Oh, for pets.
Yeah, for pets.
Okay, so the main thing that the veterinarians at the Marion Animal Hospital are concerned about right now is that as you're going into the warm weather, like we're getting geared up for spring, is just trying to head off that horrible flea problem that we had last year.
Yes.
So we're getting people on board with the Frontline now, getting people on with the oral flea preventatives now, yard sprays, talking about prevention because it was really bad last year.
Yes, it was.
And some people we had, people were hiring like professional pest control and stuff. It was terrible. So we just are not used to it, you know, because we usually have this frost, and this winter there's been nothing. And
we can expect ticks to be around.
Oh yeah.
Really bad.
Yep. So we're looking at really, we're anticipating pretty hefty tick and flea burden, probably as early as March, I would think. Usually we have till April.
I picked, actually, both my sister-in-law and I, on Saturday, picked ticks off our dog.
Yeah.
And we're, she's in Carver, I'm in Wareham.
Yeah.
And we both pull ticks.
Yeah.
So
Yeah, it's going to be really, really intense. So, and the other important thing that's happening in the veterinary community is that we no longer have the medicine to treat heartworm disease.
What?
Yeah, it's been off the market for over 8 months, maybe closer to a year now.
Wow.
So problems with manufacturing, it's still available in Europe.
Mm-hmm.
So right now, the company that makes it, which is Marielle, there's a backlist. So like right now, I have 3 patients lined up waiting for their heartworm treatment.
Oh my goodness.
So heartworm is carried by mosquitoes. So mosquitoes, especially when we're dealing with warm weather and warm, wet weather, mosquitoes are going to be out in abundance. So it's really, really important now that we're doing year-round heartworm prevention for dogs, and we actually recommend it for cats too.
Okay.
So
now, see, I do that.
Yes.
Yeah.
Yeah. So we do year-round, and well, a lot of people still are on that mentality of that we get a cold spell and the mosquitoes die.
Yes.
So you can like.
Yes.
You can.
I
Like,
wouldn't know anybody like that.
Well, no, it's very. I mean, honestly, like up toward Maine, New Hampshire, like we used to have that cold, so we used to be able to take a break, and then we did the heartworm test in the spring, get them back on the medicine. But now it's like we don't have any treatment, so that is a serious problem. For us, it's not as big a problem, but the rest of the country, especially down south, it's a huge problem. And then so we're trying to get everybody on year round, and then we're testing everybody now too, because we don't want to miss it. Because if we let it go, we have to get them on that list. So that list is a long list. So if we catch it early, we can get you on that list, and then hopefully get them treated, within a year. So that's the other thing that's been a huge problem for veterinarians.
Now, why is it that they have this problem with this?
The factory was shut down.
Oh.
That's my understanding.
Okay, so there was a problem.
Manufacturing issue. Yeah.
Yeah.
Yeah. So. I mean, it's a good thing that they're paying more close attention to how drugs are manufactured, but it makes it a little bit difficult.
And it's an expensive process to go through, correct?
Yeah, for sure. So, Marielle is the company that makes like the Heartguard and the Frontline. So that's the company that makes the imidacide, which is the treatment for heartworm prevention.
Oh, I see. They're the ones behind Heartguard. Okay.
Yes. Yep. Yeah, Heartguard is prevention, but the imidacide actually will kill the worms. It's like usually 2 to 3 injections depending on how many heartworms the dogs have. So we also seem to be having a lot more local wildlife, like encroaching, either that or we're doing more habitat encroachment. So we see a lot of foxes and a lot of coyotes around here too. And heartworm is their natural parasite.
Really?
Yeah.
Wow.
It's like where basically the reservoir comes for our pets. Also fleas. Anything, fleas love everybody. Fleas love anything that's warm-blooded.
Well, I had, which I thought Marley, my little pug, had a tick over her eye.
Oh, yeah.
And so you were closed for the weekend. So off I went to the emergency center in Seekonk. Is it Seekonk? No, Swansea.
Swansea, yeah.
And as soon as I walked in, the girl said to me, "That's not a tick."
Well, that's
because
good.
I was trying to get the tick off her, and it wasn't working. Yeah. And I had my neighbor come over from across the street and hold Marley, who's a moving dog, and neither one of us could get this tick off her, and we finally got to, like I said, to Swansea, and that's not a tick, some kind of a growth, and it's not an emergency.
Stop
you can
pulling
just,
it.
and just take it to your usual vet. And I said, okay.
Good.
So when Marley's time came to go in and get all her shots, I brought her to you, and she had that little thing on her eye, and we went through the story. And I said, does it have to be removed? And at the time, you mentioned some kind of a whatever it was, and that it could possibly disappear in a month. So bring her back in a month. It might clear up on its own. So what was that? Can you
What I was
remember?
Is it still there?
No, it's gone.
Oh.
Like you said it would be within a month. And so I was wondering what kind of a growth is that? You know, it's kind of a funny growth. It almost looked like a pimple of some sort.
Yeah.
And it disappeared on its own.
Yeah, dogs get little inflammatory growths, and sometimes they just go away. So usually that's the time period when we can tell. So if it goes away in a month or two and doesn't get bigger, then it's one of those inflammatory nodules.
That's what you probably called it.
Well, we call them. Well, there's a couple of names, but they're basically this group of inflammatory cells, and they just go away. But if they don't go away, then we should definitely, because it could be another class. And usually the ones that are more aggressive are more red. They get more irritated, and they also ulcerate the skin.
Well, I probably irritated the hell out of it trying to pull it off.
Right, after the owners traumatize the boo-boo, it gets a little hard for veterinarians to tease it apart. You say, watch it.
But, that was funny, because I said, she said it might disappear, and it did. It did disappear, which was kind of odd for me, because I had a period of where my other dog had a growth, and you had to actually remove it and do surgery on it. But
well, the other factor too in that is that she's a young dog. So those things that disappear are usually young dogs. If you have an older dog that has an appearance of a growth, it's less likely to be one of the disappearing kind.
Yeah.
It's more likely to be something permanent.
Okay, so now the other question you had earlier on food. Food is important.
Oh, I love food questions.
Food is really important, and people, I think there's an audience out there that thinks if you buy the cheaper food, it's okay for the dog, and it really. And then I heard too, the other thing I heard was a email that was going around, or an article I read in the paper. One of the others said, many, many years ago, we never bought this special food for dogs. Dogs ate off our plates, you know, whatever was left, and they didn't seem to have all the problems that they have today. Do you have any kind of a...
Okay, so the first question is food and what
Yeah.
you're feeding. Okay, so food is important, but it's also not that important. So the Food and Drug Administration, they actually regulate all dog foods to be of a minimum nutritional requirement. So even Old Roy meets a minimum standard of nutrition for dogs, as fed on the bag. What I usually find when you're moving up the quality of foods, the as fed on the bag gets smaller and smaller. So to meet the nutritional requirements from the government, you have to feed 3 cups of Old Roy versus 1 cup of IAMS to get the same number of nutrients.
Okay.
Calories is less of an issue, but they're more interested in nutrients and having it be nutritious. So it has to be nutritious for all dogs. Now that said, what's nutritious for all dogs may not be nutritious for your dog. Does that make sense? So it's like, also too, age is a huge factor in how dogs and cats handle food. So most young animals can handle a variety of maybe poor quality foods. But as animals age, like I definitely cannot eat the same thing I used to eat when I was 19. You know, it's just not going to work for me today. So as animals age too, that seems to be a much more important factor. Most pets are spayed and neutered, so a lot of times the main thing that we're usually doing with our pets is giving them too many calories. So which although moving to higher quality dog foods is a really good thing for pets, because they're higher quality, they tend to be denser in calories. So what we see is you go up the chain, if you're going from Old Roy, which we consider like the least nutritious of the group, to Science Diet or Nutro or any of the Taste of the Wild, that kind of stuff. Yeah. You need to feed almost a quarter, 25% of the lower quality foods to get the same number of calories, the same number of nutrients. So that's the main thing that we talk to owners about. You also can't leave. The other thing I find that owners make a mistake is if they're switching from a Purina to a higher quality food, they still leave the food down. They do like a buffet. So the dogs are used, or the cats are used to like auto feeding at a certain level, and then you give them this really nutritious, delicious food, they tend to overeat too. The food that gets rancid, you have less preservatives in it. So you really, if you're moving up that chain, you're spending more money. You really want to meal feed. You want to seal that bag tightly. You want to feed exactly as it says on the bag, or a little bit less. Usually that bag is labeled for a very active or a dog that's getting, having puppies, something like that, a higher activity. So I usually scant a little bit less, and then see how the dog does. If the dog's gaining weight or drinking more water, that may not be the best food for your dog. Drinking water is usually a sign that they're overloaded on something, either calories or salt. Salt seems to be the biggest factor for older pets. So I really caution owners about salt. And protein too for older pets. Older pets don't need as much protein as we're giving them.
That's just when we bring up older pets. My sister-in-law has a dog with joint issues. So she is so hung on getting a dog food that's high in chondroitin. Really, does it make a difference in a dog?
The levels of chondroitin that the studies have shown to be anti-inflammatory in joints is usually between 500 and 1,000 milligrams a day. So when you're looking at the dog food bags, you have to see, like, well, is 1 cup going to get me that 1,000 milligrams? Most of the time, it's not.
Yeah.
So although it's not going to hurt the dog, not at all, but it may not be therapeutic.
Yeah.
Most diets, you can't pack enough chondroitin in the serving, so usually we supplement with other things. Protein.